Lymphedema is the buildup of lymphatic fluid that can lead to swelling in the affected part of the body. Breast cancer-related lymphedema typically occurs in the arm and/or hand on the treated side. Lymphatic fluid, or lymph, is normally filtered through the lymph nodes in the armpit or axilla, and the fluid is then returned to the bloodstream. Both surgery and radiation to the lymph node area can disrupt or block the flow of lymph through the lymphatic channels, leading to a buildup of fluid in the arm. The risk of lymphedema is related to the extent of axillary surgery or treatment. In patients who undergo only a sentinel lymph node biopsy, the risk of lymphedema is about 5%, or 5 out of 100 patients. In patients who undergo a sentinel lymph node biopsy followed by radiation to the axilla, the risk is about 10%, or 10 out of 100 patients. In patients who undergo a full axillary lymph node dissection, the risk is about 20%, or 20 out of 100 patients. The vast majority of cases of lymphedema related to breast surgery or radiation occur in the 2 years after treatment. Being overweight at the time of diagnosis can increase your risk. Symptoms can range from hand swelling alone to total arm swelling. Sometimes the arm will simply feel heavy. Sometimes the first sign is that your sleeve, watch, or jewelry feels tighter than usual. If you notice any swelling, please contact your surgeon's office. We will evaluate your symptoms, and if appropriate, we will arrange for our lymphedema screening team to perform arm measurements and prescribe appropriate follow-up care. Treatment for lymphedema includes physical or occupational therapy with a certified lymphedema specialist. This may include skin care, exercises, manual lymphatic drainage, fitting for compression garments, and in some cases, compression bandaging to the arm. While there is no medical evidence that lymphedema can be prevented, there are ways to lower the risk. These include maintaining a healthy weight and avoiding cuts and infections in your affected arm. Newer studies also suggest that gradual, progressive strength training, when cleared by your physician, can decrease the risk of lymphedema by widening remaining lymphatic channels around the shoulder and arm. Skin infections can put you at risk for developing lymphedema. To protect yourself from skin infections, be careful with sharp objects or edges. Wear gloves while gardening or performing housework. Protect yourself from insect bites. Avoid sunburns by using sunscreen with SPF 30 or higher. Wash all cuts with soap and water. Regularly use a moisturizer to avoid skin cracking. Blood pressure readings, placement of IVs, blood draws, and infusions do not cause lymphedema. If needed, it is safe to have these performed in either arm. However, your preference on usage or selection of the arm for these tests should be respected. Research shows that you should avoid blood draws and blood pressure on the affected arm only if you have been diagnosed with lymphedema or have a history of lymphedema in that arm. Similarly, exercise does not cause lymphedema and does not worsen lymphedema. When beginning a strength training program or new exercise routine, start with light weights and shorter time intervals, then increase weight and time gradually. Be aware of your body's reaction to the exercise and try to avoid doing too much too fast. There is no medical evidence that soaking in a hot tub causes lymphedema, yet there is one study that suggests that saunas may increase the risk. If you would like to use a sauna, start with gradual exposure and monitor your arm for any changes. Finally, if you do not have lymphedema, there is no evidence that you need to wear a compression sleeve while traveling for prevention. It is helpful to get up and walk and stretch your arm during a long flight. A relatively common complication of breast-conserving treatment, lumpectomy with or without radiation, is swelling of the breast or breast edema. This happens when normal inflammatory fluid from surgery and/or radiation gets trapped in the superficial breast tissue, specifically just under the skin. It is more common in patients with larger, heavier breasts and after receiving radiation. This can cause the breast to appear swollen, heavy, achy, and sometimes painful. Due to gravity, the fluid tends to settle at the bottom of the breast and the skin may appear thickened and firm. Symptoms often improve with treatment, but in rare cases, it can become a long-standing issue that requires continued management. Treatments for breast edema include regular exercise, use of an extra supportive bra or sometimes a compression bra, and NSAIDs, Advil, ibuprofen, or Aleve to help with symptoms. Ice packs may help with comfort as needed. You may also be referred to physical therapy or occupational therapy for evaluation, lymphatic massage techniques, and compression garment fittings such as bras and tank tops if symptoms are persistent or become bothersome. Physical and occupational therapists who specialize in lymphedema care are called certified lymphedema therapists. Your medical provider will give you a referral if needed. You may also request a meeting with a certified lymphedema therapist before surgery if you are interested in learning more.